To Politics 101. We're having a late start this evening. Circumstances beyond our control, as we Guyanese like to put it. Welcome you, whether you're in Guyana, in the wider Caribbean, in Europe, or in North America, or wherever you are, and you're tuning in to Politics 101. Welcome. Our show tonight, of course, as advertised, continues our discussion on COVID-19 and Guyana, on a program that I was on this morning on CAMS TV. One caller made the point that we're spending too much time on COVID-19, that there are other issues that we should spend time on. And there was a little debate on it. And I think the consensus was that COVID-19 is very important, the most important development in the world, the most important development, of course, in our country and our region. Of course, COVID-19 manifests itself differently in different societies. I was listening to a commentary about an hour ago on MSNBC, and this person was making the point that what COVID-19 has done is that it has exposed the frailties of American democracy, and that's something that I agree with. In terms of Guyana, I think we also have our peculiar circumstances. We are a deeply divided society, ethnically, politically, maybe ideologically. And here we have a pandemic that the consensus is that it requires some degree of unity, some degree of national commitment and national consensus. But our Guyana has been a place that those things have been in very short supply: national consensus, national unity. And that makes tackling the COVID-19 problem somewhat more difficult for us than our Caribbean neighbors. Because in a sense, it's a kind of all house pan all house. We already are divided politically, and what we have seen is that there is a concomitant division as it relates to the pandemic, in particular the vaccines. We have a critical mass of people. It appears to be on one side of the political divide that are very suspicious of vaccines and have raised their voices, and that anti-vaccine sentiment seems to drown out all the other elements of COVID-19. We don't talk about masking a lot in Guyana now. We don't talk about sanitation. We don't talk much about testing. A lot of the conversation is driven by anti-vaccine suspicions about vaccine, and that is molded, morphed into anti-government. So you have anti-vaccine, and then the same people generally are suspicious of the government, which makes it extremely difficult to have a conversation on the public health implications and consequences of the pandemic for us. In the meantime, our numbers continue to go up as far as deaths are concerned. They're also going up as far as infections are concerned. We are not doing well at all. We are, I think, number six. We're number 4 as far as vaccinations are concerned, but we are number 6 as far as infections are concerned. I think that's what the data coming out of CARICOM is showing. So So we are not in good shape. Over the last 2 weeks or so, there has been an effort to renew the conversation, certainly on the opposition side, as it relates to COVID-19, because we run the risk, as many people are coming to understand, that when we talk about vaccine suspicion and we talk about anti-mandates, that could be read by our people to mean that we are anti-COVID, meaning that we don't feel COVID is a big deal. And so therefore, there is a need, in my view, for us to broaden the conversation on COVID-19, not just to talk about what we are anti, but also talk about how is it that we are going to save our people in the community from dying, from getting infected, and from dying. So there is a need to broaden the conversation. One of the problems is that the government has not been providing the kind of information on this matter of COVID, on the matter of the vaccine. And so people have been left to go online and to get information online, and we know that that information could be very faulty, could itself be very suspect. And so the need arises that for us to deal with the question of informing our people. Now, one of the things that we have come to understand is that a lot of this has to do with trust. I think that even if the government were to tomorrow begin to provide the kind of information and informed discussion that is needed, I think those people who are already hardened against the government are not likely to give them a hearing. And so it is very important for persons, leaders, who our people are more likely to trust to get into the conversation. There have been calls for the government to include people from the opposition in the national task force. They've been reluctant to do that. This morning I called on a program that I was on that the opposition should take the bold step and set up its own task force, because I think we have the kind of medical experts, political experts, communication experts on our side in Guyana and in the diaspora, in which we can have our own task force to deal with this problem, because we cannot allow the conversation to be driven by fears, people's fears, and we do not take a sober and professional look at what is happening in our communities in particular, but Guyana in general. And it was with that in mind that I invited these two ladies, Honorable Kathy Hughes and Honorable Dr. Karen Cummins. Dr. Cummins is a medical doctor, and so she brings to bear that kind of expertise to the discourse. And Kathy Hughes is both a politician and a communication expert. And I think politics, communication, and public health knowledge are key to us having this conversation, and in our difficult circumstances, trying to overcome the COVID upsurge. So here we are this afternoon, and I'm sure that we're going to have a sober discussion, because this discussion has to be sober. It cannot be driven by rancor, as the government would want us to do. It cannot be driven by anti-vax and pro-vax people arguing with one another as to which of the two positions or which of the two situations is better. What we need is a broad conversation that speaks to every facet of the problem, but the public health discussion, I think, leads the way. So what I'll do, I'll start by having a discussion with our two guests on whether they think the government is doing a good job, where has the government gone right, if it has done anything right, and where it has gone wrong. And having diagnosed that, then I would want us to talk about what we can do as leaders to pick up the slack and to fill the vacuum that the government is not filling. So welcome, Kathy Hughes and Dr. Karen Cummins. Kathy, I'll start with you and give Dr. Cummins a chance to catch her breath. She was hurrying to catch the program. So normally I would give her the new ball, but in this instance, I'll give you, Kathy, your overall assessment of how has this government done as far as managing the COVID-19 is concerned.
Thank you very much, David. I really want to start today's program by extending sympathies to the family of Mr. Tom. As you know, we lost him today to COVID in the COVID hospital. And this is a man that has supported, encouraged, and nurtured many of his listeners over quite a few years in some difficult times that Guyana has gone through. He's always been very committed to ensuring that we all try to work together and to move this country forward. And it is a huge loss. And in fact, this conversation is timely, David, because it shows us that COVID is real. And there are some of our best people that we are losing to this pandemic. When you ask about what went wrong or what the government might have done wrong, I want to start off by saying the biggest mistake Guyana made, the biggest mistake the government made, was to make this a political issue. And we started off, when I say that, when this started in February of 2020, you know that they were, and we can go back, the beauty about the technology is that it's all there for us to see. We have members of this current government that went out to their way to suggest that this was false, this was the government trying to stay in power longer, and all these different aspirations. What is the result of that kind of approach? What is the result of when you were invited to come onto a task force, you refused to come on? The result is that you automatically made COVID a political issue. So you had persons based on the politics, whether you were pro-government or anti-government, taking a position, and not Guyana and Guyanese being unified over a very tragic and important health issue. If we were working together as one team, then we would have been able to cover and reassure the majority of Guyanese as to what their approach needed to be in the interest of all of us. There would have been less suspicion. The fact that that has never happened, we've not encouraged. We started off on December 30th, the Minister of Health saying, we're not going to make vaccination mandatory. And now we come to September and we're forcing it down people's throats. And I want to say that I took the vaccine. Given the circumstances, I know it is a personal issue. It is a recommended approach, I think, but our approach should be not forcing people, but having doctors at the stadium, at all locations, sitting down and speaking one-on-one with all these people that have valid concerns, because persons have valid concerns. I met a woman the other day who is sickle cell. She can't go down to the Georgetown Public Hospital and wait to see a doctor. There are no doctors at her health center. So she really, honestly doesn't want to take the vaccine because she hasn't been able to have that one-on-one conversation with some medical personnel to say, this is my history. This is what I would like advice on. And there's so many people for religious issues, for health issues. how do we deal with those groups of people? We can't just say that because you got an issue, step aside and you ain't gonna get paid and you can't go here and you can't go there. And it's the same issue, the same approach we realize in every part of the world is not working, because people automatically become suspicious when you're trying to force something down their throat. So the approach has to be speaking with them, encouraging them, and winning them over. And I think their PR campaign has failed to do that. Giving us the numbers every day, who is sick, how many cases at home, whatever, does not cut it.
Kathy, you was there opening up and identifying the politicization of the problem, which was started by the PPP.
Absolutely.
Yes. The inability to communicate with people who have fears, and
Yeah.
thirdly, taking the most extreme option of trying to beat those people into submission.
Mm-hmm.
All of this going on against the backdrop of at least half of the population feeling that the government is not legitimate and suspicious of the government, and obviously translate that to mean that the government could be using this COVID moment in order to score political points on them. That is real. Those concerns are real. Thanks, Kathy, for articulating them to start the conversation. Let me bring in Dr. Cummins. And I'll put the same question to you, Dr. Cummins. Obviously, you will come at it primarily from a medical standpoint, but you are free to talk about it from the political and PR standpoint if you care to. Where did the government go wrong?
Thank you very much, David, and good evening to our viewers out there. David, the question you asked me is the government doing a good job at COVID, managing COVID? Certainly not, because recent developments have pointed to an ineptitude and a lack of concern for the citizens of Guyana. The APNU AFC coalition was always prepared to support common sense and any practical measures with regard to COVID-19. So what we have seen, there's no comprehensive plan for the response of COVID-19. What we have seen is a strong arm tactics, which will lead to resistance and resentment. That's what we have seen. I have spoken time immemorial about this COVID-19 has given us a unique opportunity for us to work together, and so that we can work together as a team and dent the uptick of this COVID. Right now, we stand at 687 deaths with over 2,800,000 confirmed cases. And so what the government would have done wrong is, first, as I said before, would have gotten no comprehensive plan. The coalition government, we had a national action plan for public health in response to COVID-19. I know Kathy can bear me out in that. We took a multi-sectoral collaboration approach, a well-coordinated approach to ensure efficiency and effectiveness. We had a framework which articulated roles and responsibilities of different players. You know, we had clearly outlined, very elaborated with governance, what should happen in terms of governance, in terms of management systems, in terms of operational procedures for health, for the government, for the society at large. And so all in all, we had strategic priorities. You know, as I said before, plans of action, which we had a budget to it. There were clear targets, there were timelines, and, you know, how we monitoring and evaluate. And we took into account all the various sectors, agriculture, health, and so forth. For instance, to protect the health and the safety of the Guyanese, We noted that schools and universities were closed. The buildings were sanitized. We recall the national grade 6 examinations were postponed. Students, worked at home with the assistance of the teachers through virtual platforms, digital technology, the radio, television broadcast. They was taken out of dining and groceries as we try to curb, this COVID-19. We ensure the safety on the job of all medical personnel and technical staff. There was a rotation system which was implemented, and special taxis arranged to ensure the safety of nurses and other allied health workers. To contain the spread of the heavily populated urban areas, we had, of course, social distancing was practiced, sanitation and hygiene was emphasized. We had sinks were placed in strategic places to ensure less transmission of the virus. We even tried to address the social and economic impact on the livelihood of Guyanese people. Efforts were made by the Agriculture Ministry to roll out, we call something called REAP, Rural Entrepreneur Agriculture Project, in the hinterland and the coastland regions. So there was the pursuing of the suspension of the common external tariff on key consumer commodities required by businesses to boost production. We also had something called CASE, Coordinating Agency for Small Enterprise, so we can retain jobs and employment creation, to alleviate poverty, to stimulate local consumption, increase production. In fact, when we were giving these, we call it bags, of produce to the less fortunate and so forth, handouts as we would call them, they were taken from the local farmers. We made the hampers, so to speak. Of course, you would recall we restricted or we imported cases into Guyana because there was border closure and control. Even those are the palms and geriatric, all senior citizens, those who had COVID, all of them recovered, and so the list goes on and on. So what we saw was when we left, there was community spread, cluster spread. And so when we were there was cluster spread, when we left, there was community spread. And so what we're saying that for the government the regime, I should say, to have come in to abandon our strategic plan that we left in place was foolhardy at best. And so the inability now to govern and to have this kind of transformational leadership, it's difficult. And so that's responsible for the uptake of cases, the over 28,000 confirmed cases, 687 deaths. And of concern to me is Region 4, because you would know it's our stronghold. And if you're going to have over 13,000 persons cases there, and they say when it has been said that when you see one person has COVID, you have to multiply that by 3. So here we're talking about numbers, and Region 4, the urban areas, it's concentrated. That's if we want to use the term epicenter. So it's really a sad state of affairs. And so I'll stop there for now to say definitely they have not, they have shown their ineptitude and lack of concern. Hence, we have seen the uptick of cases. So they have not done a good job so far.
Kathy, Dr. Cummins laid out there the initiatives taken by the previous government and the abandonment of all, or at best most, of those initiatives. What was the thinking behind them from your political observation and your proximity to them as the government in waiting, as a member of the government in waiting? What do you think was the thinking that drove them? What was the economic thinking? What was the political thinking? What was the public health thinking, in your estimation?
Well, this happened at the time of when we were going through our election and the aftermath of the 2020 election. And so when you make this a political issue, you start off by saying that, hey, this doesn't exist, right? So you send those messages out there. This doesn't exist. This is them trying to hold on. And then you start an agenda where everything that the APNU AFC does has no value, no worth. They are worthless set of evil people. So I ask people, imagine if we did not have that facility at Liliendal. Do you remember, go back in the news, every day we were cussed out, you're spending too much money, why you need to do this, who the property belonged to, all those different things. That was the discussion that took place. An inability to act as a true leader and in a time of crisis to come forward and be willing to work together. And so after you cuss up the government, the then government, you say that COVID is a lie, that the hospital is a waste of time, they don't know why they're doing it. And now you get into government and you now have to say the exact opposite. The exact opposite. So how can people trust you? There's a complete loss of trust. Now look, it's very interesting how in the last 6 weeks they've been saying that it's a lot of African Guyanese that have not been vaccinated. Now let's look at what's happened to a large percentage of our population over the last 12 months. Now, whether it is perception or whether it is reality, the facts are that you have close to 50% of the population that feels that in this government, there is not an equal role that African Guyanese can play in the livelihoods. There's not a fairness. We've heard this every day in the stories of how the COVID grant is distributed, how the education grant, they're just endless stories. Recently, how the agricultural grant. So you've created that perception. If it is not true, you've not done enough to attack that perception. And so you have people today, because I hear from them, that say, boy, we're the people that never get an increase in salary. We're the people that looked after you as teachers and kept the education system going. We're the nurses when this started that didn't stay home and call in sick, but stood up and faced it head on and did their best. And now all of a sudden, you are saying to us that there's no value to you. We don't need you. Whether you are there or not, it doesn't matter. And now you're saying that, guess what? You're taking what they see as victimization a step further, because you're now saying that, guess what? I am going to make sure that you can't live, that you can't feed your children. Because if you don't turn up and do as we say, you will not have a job. You will not get paid. You will not be in a position to look after your family. Whether we like it or not, that is the reality that many people come to. And I was horrified today to have a group of people tell me, and I'm only reporting what I heard today, that there are places on the East Bank you can go. They will give you a cotton ball. They will pretend that they gave you a jab. You will get a vaccination card and everything, but really you didn't get a jab. Now, the fact that the government last weekend could say that 30,000 people have not gone back for the second jab of AstraZeneca means that by itself is an indication of how much you're failing. That you have such a large number of people that would have taken the first jab, but you've lost them by the second time. And therefore, you have to be bold and say, what we've done is not working by our own admission. And how is it that we correct this? And that's why I'm saying the only approach is when we can get together and say we got to deal with this as a country. And you look to places like Jamaica. Jamaica, we all saw right here in Guyana, news reports that the Prime Minister of Jamaica met with the opposition leader and they sat down and they said, COVID is serious. In fact, they announced that the second virus, I think you pronounce it the MU variant, is now in Jamaica. And up to now, we haven't had our Minister of Health confirm that the Delta variant is in Guyana, right? We've had PAHO that said that ages ago, and they were on the tail of prove it. And now they're suggesting that the Delta is here. But no one is bold enough to say, it is here and this is what we're doing to deal with it. So all of these are the flaws in our approach. And the numbers are supporting that this approach is not working.
Dr. Cummins, thank you very much, Kathy. Dr. Cummins, let me bring you in here. We've had the robust political debate, and that is inevitable in a society that is so politically divided. But tell us what the impact of this over-reliance on political action to deal with the pandemic. What has been its impact on public health itself? I mean, when you lock out nurses, when you lock out teachers, explain to us how is that impacting the healthcare system in general? Is Dr. Cummins with us, or we've lost her?
We just lost her.
Kathy, let me bring you in while Dr. Cummins thing, and I put the same question to you.
Sure, you're asking,
if you can.
Absolutely. So you're asking how it impacts the health services.
Yes, all these mandates.
David, it's only common sense that every single nurse that you see in a protest line or outside standing up is a nurse that should have been working and looking after some patient in some health center, in some hospital somewhere. And we saw that at Georgetown Hospital. And now what we're hearing is reports. As you know, in the last week or so, we've had about two different families that have started to suggest that the treatment at the hospital at Liliendal, the health services, the treatment, the care, the nutrition is not up to scratch. And I say that if you have some of your staff standing outside instead of being inside working, then there must be an effect to that. There must be an effect. So every single nurse and every single doctor that we see a picture of standing somewhere in this country has a job, has a service, would have been protecting the health of some individual somewhere. And therefore, we cannot be operating at an optimum level.
And so therefore, we have a situation where the very healthcare system which we are trying to boost in the era of COVID-19 is being destroyed and being assaulted.
And put under more pressure.
A lot of pressure. Kathy, you've been obviously following the debate on the vaccine. Yeah. And I said in my introduction that the vaccine debate has seemed to have taken over the larger public discussion for obvious reasons, because that's where the contention of government imposition and government mandates come in. How do we treat with the anti-COVID discourse and the suspicions therein, and the government mandates to beat people into taking the COVID-19? How do we treat with that, while at the same time talking to people about the larger COVID-19, larger impact of COVID-19? How do we navigate?
So I want to use one example. As you know, a couple of months ago, there was a lot of concern about the purchase of vaccines that were being done, not government to government, but a third party. And we had a situation where we actually had a representative, a sheikh that came to Guyana, and later we know that there was that whole controversy about the vaccines. Now, if you look at that, there were some very genuine and real questions and concerns that were asked. The opposition asked them, and maybe because the opposition asked them, the government automatically felt that, we don't deal with the opposition, so we don't have to answer them. But other persons asked them too, can you guarantee the safety and the efficacy of these vaccines? After hearing for months, as the vaccines were developed, how important it is for it to be stored at the right temperature. We heard what different countries were doing, how we saw the airplanes arriving in different parts of the world, and in Guyana, the refrigeration. So people are informed. And when we say to you, where did these vaccines come? Why are we paying so much more? Were they properly stored? Your response should have been to convince us that every step of the way, we had absolutely nothing to worry about. So the data on why we paid a little more, if there was a plausible explanation, the government had a responsibility to present that. I would have showed the tracking of those vaccines, where it came from, who transported it. If you have nothing to hide in this digital information age, share it. And the response could have been, oh, man, they ain't doing too bad a job, because they told me it went from here to there to there with these people, with that person, with this refrigeration, whatever. Your responsibility is to convince me, because I have genuine concerns. And every step of the way, that is the approach one has to take. It's not optional. You can decide that you ain't answering. And then once you don't answer, you have an entire media force, and every single person that wants to call themselves an investigator on the line, on the internet, searching, and then coming up with information that is contradictory. So the fact that there's no transparency automatically makes the situation even worse. And if we come to the table in an honest way, if the Delta variant is here, why can't you say, folks, the Delta variant is here, and now we are going to have to do X, Y, and Z? Because when we look at other countries, this is what we know the impacts could be. It spreads much faster. Now we got the Mu variant. Jamaica has stood up and said, guess what? We just did 92 samples, and 26 out of those 92 samples are of this new variant. All of Jamaica knows that. We don't know. We don't know where we are. And the impact and effect of that is on a Friday night. Go just outside Alberton Police Station. Go on that street that is perpendicular. I forget the name of the street right now. And you will see people. I saw it 2 Fridays ago. Everybody liming at the Chinese shop, at the shop. Nobody got on a mask. Nobody has on a mask. So there's no enforcement.
Why do you think that there is the frenzy at the top? And I'm putting this to both you and Dr. Cummins. There is this preoccupation with enforcing mandates, but not the same preoccupation with enforcing at the other end things like hygiene and mask and social distancing and all these big parties and liming. What's going on there?
Well, and I'll let my colleague Karen start off, since I've been speaking a lot. Karen, you want to go?
She came in and
okay,
she's gone. So
and this is exactly part of the problem. People aren't stupid. People are not stupid. So you're telling me I must go and take a vaccine. And as I said, I took it. I'm not an anti-vax person. I took it. I think we're between a rock and a hard place. And for me personally, and for my family, it was better to take it than not take it. But guess what? I had a lot of concerns. I still have a lot of concerns. And every day I pray and say, Lord, make sure that this was okay and this was the right decision the whole world is making, because that is the reality. But when you are not fair and even-handed, we had reports in the papers of some of the entertainment spots I'm not saying it. Go on social media. You'd hear that Palm Court stay open longer than certain places when we had the curfew. A lot of the entertainment places spoke about that. We had a very rigid curfew. You got a bus and you're picking up people, but you're going in certain areas. You're not going in other areas. Guyana is a small place. Everybody knows. We know what's going on. And like I say, you just got to drive around and open your eyes. And you see people liming with without the mask, and they listening to music and they gaffing and they talking. Totally oblivious. And we know, which is what we're seeing right now, the healthcare system has the potential to collapse. Because every part of the world, you remember New York, if New York could not deal and ran out of hospital beds, India ran out of oxygen. What about little Guyana? With one hospital and a couple other hospitals that just got a few little beds? Really?
Is Dr. Cummings in? No, I think she's dropped out again. She's having some technical problems. Kathy, we've been calling on the government to provide information to include the opposition in the task force. They've been resisting that. In the meantime, we're seeing the numbers go up. What is the responsibility of the opposition parliamentarian, the responsibility of the opposition leaders, whether they're former leaders or informal leaders? What's our responsibility in such circumstances?
Our responsibility is definitely to keep Guyana safe. Our responsibility is to share as much information that we get. And I personally have been encouraging persons. I have several people that call me up and say, you know, Kathy, what's the story? I haven't taken the vaccine. I don't want to. But so-and-so. There are about 4 people that I've actually put them in contact with a doctor. And I always say it's your personal decision, but why not speak to this person? They're more than willing. You speak to them one-on-one and make a decision. The reality is, though, that each and every one of us has a responsibility. I feel as an opposition MP, right? I know we like to be categorized as the opposition MP. It should be just a member of parliament working in the interests of Guyana. But I feel we have a huge responsibility to educate where we can and to inform. And this is where I have gone to outreaches, especially not so much in the last 2-3 months, but certainly as 6 months ago. We were going out to several communities, social distancing procedures in place, and speaking to small groups of people. And what I felt was so sad is that they would ask me questions on government policy and government plans. And because I've been left out, I can't convince that group of persons. All I could tell them is what I'm reading in the newspaper, like any other person. Because there's no leeway, there's no opportunity for the government to say to the opposition members, guys, this is what we're planning to do. Tell your folks that this is going to be the next step. Tell your folks that this is the good thing, this is the bad thing. They're not giving us any of the flyers and saying, please, when you go out, spread the word for us. They haven't called us to a meeting like big people and say, you know, what are the concerns in your communities? You're nearly 50% of the population. What are they worried about? And then they come back and say, look, for these people, we got this approach we could do. Do you think this could work? Isn't that the logical way to do it is? It's not rocket science. Isn't that going to reap more results? And I see Karen here. So before she drops out, Karen, please jump in.
Dr. Cummings, let me ask you this. A lot of the viewers are asking about the vaccine. That's on their minds, and for obvious reasons. Please tell us, from a public health standpoint, what are the pros and the cons of taking the vaccine? You have to unmute yourself. We're not hearing you.
Yeah.
Yes, thank you for the question.
Yes.
As you know, vaccines are always a powerful tool, and if, it's very effective. We have used it from time immemorial, and it has saved lives, preventable diseases. And so we would recall since 2019, 2020, when this virus would have started, be it in Wuhan, whether it's gain of function, whether it's wet market, whatever it is, it's here with us. Worldwide or globally, it's over 190 something million cases, persons of this disease. We also have seen globally 2 million deaths. So as scientists and public health, we just can't sit back and say, oh gosh, what are we going to do? Of course, we would have said the public health measures, social distancing, sanitize yourself, and so forth. But the scientists, knowing them, and they would have gotten experience from SARS, H1N1, I think it was 2003 or so. So they would have gotten ideas of how to work with this virus and see what they can do to contain the virus. So they've come up with some vaccine. Of course, it was investigational, and we say it's just emergency use. But so far, Pfizer has been approved. It's not for emergency use. That's the only one has been approved for use. So we know we have to follow the science, and we know it has the vaccine has saved lives. It has decreased hospitalization and deaths. So it will be foolhardy for me as a public health specialist not to say to take the vaccines. But there always will be a subset of persons who cannot take the vaccines. Persons with comorbidities like diabetes, low platelet, persons, some immunocompromised persons. So you will have to speak with your physician. That's why we have primary care physicians, we have family physicians where you can talk to until you feel that you're capable, your diabetes is controlled, and so forth. Just to digress a bit, right in my village here, about 3 persons lost to COVID, and they were diabetics. And people say, you see, you go and take the vaccine. I know you're not. So that of itself has turned persons, will have vaccine hesitancy. And so that's why I said the PR is so important. Of course, we have to balance our must be a compromise between liberties and public health measures. And so we want to save lives. Like as I said before, it has proven to save some lives. More persons would have died. And so what you have to say, listen, I know the persons are, because what we have among our healthcare workers and even the populace, we don't have persons who have conspiracy theories. We don't have anti-vaxxers. They just want to process it some more and say, okay, I'm not quite ready, but now as you talk to me and so forth, they will take it eventually. So it's just like coaching them. I said sometimes you could give them some incentive and, talk to them, show that you're caring. And you'll get them to come around. They're not anti-vaxxers, just that they need to know more about it, but what it is all about. And persons are taking the vaccine when they're active COVID. You have to, you can't take it when you're active. So all these things people just need information. And so we have seen the impact, persons are being locked outside. And then going back, I wasn't able to tell you all the things that we would have done. During our time, in fact, what we're seeing here now with the government, they're sending home persons to home isolation. During our time, we used to fund persons, those who have gotten the COVID. We put them up in hospitals, put them up in hotels, and so forth. And then when they would have recovered, when you have 2 PCR negative tests within 72 hours, and then we send you home. So when you go home, when you hit the door going home now, you're COVID free, so you're sending persons home with isolation, mixing with the grandmother, what you expect, there will be skyrocketing of cases, so it has to be thought through.
Dr. Cummings, in Parliament, you all have what you call shadow portfolios. I think yours is Shadow Minister of Health. Do you think there is the time has come, since the government is not including the opposition in their task force, do you think the time is coming, I'm putting this to Cathy, for the opposition to establish its own task force. It may be a symbolic measure, but do you think if that were to happen, it could have an impact in instilling confidence in that section of the population that their people are on top of this issue in a formal way, rather than being on the outside? Do you think it's the time has come for that? Go ahead, Kathy, and then I'll come back to that.
I hear where you're coming from, but I want to say, why is it so difficult for us to do the right thing? And the right thing is not to have another task force and people say, well, I only gonna listen to one task force and you gonna listen to the other task force. When are we gonna stop with that nonsense? When are we going to grow up and decide that every single life in Guyana is important? And it's not just the government that has a monopoly on education, on knowledge, and they're not the only people that have possible ideas to share on how we as a country, as a united country, they like to say as one Guyana, how we can get out of this together. So we are already, as you know, Dr. Cummins has been sharing all this information in press statements, in press conferences. I mean, it's not as if we haven't spoken to it. I don't know what else more that we can do. The problem is that as an opposition task force, we would not have the government-to-government relations and connections. We won't be in the information line with what's coming down from WHO and all those other agencies because we're not in government. And therefore, I mean, to me, there would be limitations to how effective that we are. And my point is, why can't we do the right thing? I expect us to be big people and start doing the right thing.
You mean why can't they do the right thing?
Why can't they? Yes, all right. When I say we, I really talk about.
I know you're using we. Right. Dr. Cummins, you still there?
Yes,
I want to get your views.
Yes, I subscribe to what Kathy has said. I endorse her statement because there's no shortcut to this thing. This is, as I reiterate, this is a unique opportunity for us to work together, both opposition and as a regime, well, the government, I don't want to say legitimate government, but to work together so that we can dent the bottom line is to dent the COVID deaths. We want a workforce that is a healthy work. We want a healthy workforce. The health of the nation is the wealth of the nation. And so we can't afford to lose the bodies like that. So we have to decide mature politics to come together. When it's time to vote, it's time to vote. But right now, the bigger picture, we got to look at the bigger picture. The bigger picture is to decrease the deaths. Since 2020, when we have limited office, to now, you will have different waves and so, but with all they're doing, you're not seeing a decline. Even if you see more cases, but why you're not seeing a decline in deaths? So we have to come together, work together, put our hard heads to the wheel, and see how we can do it. And we had a very comprehensive plan for each sector, for agriculture sector, foreign affairs, for every sector you can think about. We have a strategic plan. We have what we call it, National Action Plan for Public Health. I have it here. I'm sorry, I can't put it on share the screen, but this is what our plan. So we had a plan. So why you want to throw it down the window because it's opposition? What isn't good for what you see good there, use it. So I don't know. I would hope that good sense will prevail.
Let me ask you this, Dr. Cummins. Testing. Would testing be an effective deterrence? How effective is testing? What would it tell us? How would that help to decrease the cases of infection?
David, our party, the coalition party, part of our, I wouldn't say moot, but we had the 3 Ws, the 3 Ts, and the 4 Es. The 3 Ws, most persons know that. Wash your hands, wear your mask, correctly all the time, cover your nose and your mouth, and watch your distance. We had the 3 Ts of testing, contact tracing, and treatment. And then we had the 4 Es of engaging the community, engaging the populace, explain to them what COVID is all about and what your expectations are, encourage them to follow the right path. And if they don't do that, then you enforce the law. So we had, those were, I won't say our mantra that we work by. And so you must, so as I was telling you about the isolation. So when you go home, you're COVID free. And so we would already test before you go home. You already have done your 2 PCR tests, 72 hours apart, negative test. Then you go home. And so when you go home, there's no sharing. Of course, you continue the mask and so forth, but there's no sharing. You know that when you go through, this person is negative for COVID. So testing is very important. When we started, we were now trying to get the PCR test, and rapid the antigen test was now coming out. And so this novel virus, it's evolving. And so when we came in, we had all those luxuries, so to speak. We just had the PPEs and the normal PPEs and so forth. But we tried to contain the virus because we used other measures, which paid off. Because when we left, it was just two-digit deaths.
Yeah. Someone in the audience is asking you to explain the relationship between testing and keeping down the numbers of infection. How does testing fit into the whole scenario? What testing does?
Yes. You're testing to see if you have the antibodies, if you have gotten, you're exposed. And then if you're exposed, okay, persons are exposed, but then you may have mild symptoms, and so that won't bother you too much. But if you're exposed and maybe you have comorbidities and so forth, I mean, it's a guide to know that you have to take it seriously. You may have to follow up. You may have to isolate yourself. You have to go to what tier of the healthcare system you have to go. Move from regional health system to the intensive care unit or the case like that, like that. So testing is very important. And that's how we when you test, you have the contact tracing, the other relatives, the first degree relatives, the second degree relatives, so you can go through to see how many persons exposed. So testing is very important.
Do you support free testing or at least affordable testing?
Man, let me put my mouth. Probably we're all rich country. We have less than 1 million people, and I don't want to be political here. I don't want to sound like a racist. Because what we have to do is to follow the science. If the evidence shows that even in the ICU, 40% or 60% is from Afro-Guyanese. We know that we can trace the communities where they're coming from. We know the status, the economic status of these people, the rural areas. And so we want to impose on them a PCR test. Other places, America is doing it for free. America is doing it for free. Why can't we not do it for free?
Yeah. Kathy, let me bring you in on that. Dr. Cummins, there's a question here from someone who's asking, I need to know how the vaccines work. Passive or active? Person seems to be in the medical field. Must be a nurse or something. So while you think about the answer to that question, Kathy, I bring you in on the question of affordable testing or free testing.
David, right now a PCR test costs $25,000 or thereabout. There are few people in Guyana that could pay $25,000 today for a test and not blink at it. It's a minority of people. You imagine, and this is why the testing should be absolutely free. Dr. Cummins was telling us about 2 PCR tests before you go back into the home environment within 72 hours. You would be asking somebody to find $50,000 before they go home? That is an impossibility in most families in Guyana today. So what would they do? They can take one test. In fact, many people are doing the antigen test. They're doing the test that a test for whether you have the bodies. You get paid $8,000, and you go and do the test, and you come back and you say you don't have COVID, which we know is not a foolproof test. But who is going to be able to afford to pay 25,000 today and 72 hours, go pay another 25,000, and then I go home? So you do the antigen, or you do maybe one test, and you go home, and you're spreading it to everybody else, because guess what? You're not totally free of it.
We seem to have lost Minister Hughes. I see Dr. Cummins is coming back. Dr. Cummins, we have a nurse here who's asking, I need to know how the vaccines work, passive or active? Yes,
Right.
go ahead.
Yes, thanks for the question. First of all, the COVID-19 vaccine, why are we giving it? Because it prevents you from getting COVID, from becoming seriously ill and dying due to COVID. As we said, the vaccine prevents symptoms. It tries to, minimize symptoms, hospitalization, and deaths. That's the evidence has shown that. It prevents you from spreading the COVID-19 to others. That's what it's intended to do. It also adds to the number of people in the community who are protected from getting COVID, making it harder for the disease to spread and contributing to herd immunity. And lastly, it prevents the COVID-19 virus from spreading and replicating, which allows it to mutate and possibly becomes more resistant to vaccines. And we know we have gotten the different strains, And the big portion of the argument is that, okay, we're vaccinated and unvaccinated is transmitting the virus, because we have breakthrough deaths and breakthrough because of the vaccination. Those who have been vaccinated, we have breakthrough infections. And so people are wondering, why is it you still want to take the vaccines? Of course, vaccine alone, as I keep saying, is not, it has to be holistic. Because according to WHO, health is not just the absence of disease, but the total well-being of the persons. So you have to be healthy eating and taking your supplements and your hydration and so forth. But coming back to that, the less of the two evil, because I've seen persons who go to the herbal treatment, they for a piece of time, but they still get COVID. So we're trying to say that at least the less of the two evil is to be vaccinated. So we have what we have in Guyana. We have the Pfizer, which I said is the only one that's approved. The others are still emergency use. So we have the Moderna. I think in Guyana we also have Johnson & Johnson. And we have Sputnik. We have AstraZeneca. So the Pfizer and the Moderna, we call them mRNA vaccines, whereas the Johnson & Johnson, AstraZeneca, and the Sputnik, they are vector vaccines. The difference is...
Explain the difference, Dr. Cummins.
Yes, that's why I'm coming there. Yes. So the Pfizer and the Moderna, they are, as I mentioned before, mRNA, or we call them messenger RNA. I don't want to go into biochemistry and immunology, but I'll just try to be brief and a synopsis. Right? So the coronavirus have a spike-like structure, which you know about, it's spike proteins on their surface. All right? And so the COVID-19 mRNA vaccines give the cells instructions for how to make a harmless piece of this S protein. So after vaccination, your cells begin making the protein pieces and displaying them on the cell surface. So when your immune system will recognize that the protein doesn't belong there, and begin building, and it begins building an immune response and making antibodies. That's for the mRNA. The Johnson & Johnson, the AstraZeneca, and the Sputnik, that's a little different. As I said before, that's vector. And so in this type, they have genetic material from the COVID-19 virus, right? Some of the genetic material from the virus is inserted because like a weakened live virus. So, we call it adenovirus. All right. And so when this weakened virus get into your cells. It delivers the genetic material from the COVID-19 virus that gives your cells instructions to make copies of this S protein. And so once your cell display the S proteins on their surface, your immune system will respond by creating antibodies. So it's like an antigen antibody kind of complex, right? So you recognize a foreign something foreign, your cells go towards it and try to neutralize it, as it, simply put, So it's slightly different.
Yes, but achieving the same end because it protects the immune system. Dr. Cummins, you listed 5 vaccines there. There are people who are hesitant. If it's, I don't know whether it's unethical in your field, but if you were to speak to some people who are hesitant, which of the vaccines you would recommend to them as perhaps the most effective?
Well, right now, as we are fortunate to have at least one that's approved fully, and you want the best for your country. You want the best for your country. But at that point in time, it's that, as I said before, rather than stand still and don't do anything, you want to do something. So at that time, whatever was available, you advise them to take the vaccine. I took Sputnik, the adenovirus, the one that's a vector virus, vector vaccine. So had I been in a position now, I would have gone for the Pfizer. But what I'm saying, the fact remains that you want to contain the virus. And so the more persons are vaccinated, we develop herd immunity. More persons get it, more exposed to it. So, you develop, like, I won't say natural antibodies after a period of time. And so you're able to contain the virus. Because what's happening now, that persons are not vaccinated. So the virus comes, David, and say, "Oh, you vaccine, all right? I ain't gonna bother with you. I'm going to catch you who will vaccinate." The virus kind of sensible. "Oh, I ain't gonna touch you because you cover yourself. You cover yourself. Let me go to Cathy who hasn't covered herself." So it's going, going to some other persons who are unvaccinated. That's why we try to tell persons as much as possible try to be vaccinated. First, I said it's an evolving virus, and initially we said, "Oh, it's just for the elderly," and then next thing you know, next to Brazil, we had the P1 strain, coming. Next thing we had the adolescents, and then now it's going to children. So it's just changing its dynamic, so to speak. So I would advise to eat healthy, try to build up your immune system, and take the vaccine. But just make sure you talk to your healthcare physician or primary care physician to find out what your comorbidities are, and be honest. Confront the issue. Okay, I am diabetic, or I am immunocompromised, or I am low platelet. I trouble from thrombocytopenia, or I trouble. Tell them so they know that when you come there, okay, well, I think you can get this vaccine. Just wait a little more. Try to build up your immune. Let it come to a particular level, threshold or whatever it is. But what you find, some people might be telling lies to. They don't want people to know. They're very secretive, health, of course, people don't want to know your business, sort of, So you find persons are not, and the public trust again. You see, if they had done a good job before the rollout of this vaccine, it would have been easy, But persons are, they don't trust them, so to speak. You don't trust what they're giving you, trust who you're talking to, So this public trust and confidence is not there, So people have to confront, to have such a good rapport with the physician and patient relationship. It's very lacking in Guyana. So we have to improve our relationship with our doctors, so we can tell them almost everything. Don't advise you to wait. You need to build your immune system some more, then go. Right now you have active cases, now you're having some symptoms, wait a little, or something like that. But you have to keep the dialogue going.
Cathy, there are 2 categories of workers who are critical to this whole situation that we're dealing with. And both categories of workers have been on the streets recently. I'm talking about nurses and doctors and teachers being critical. And I want you to speak to both of them either together, speak to each of those categories because of where they're located and their importance to the overall safety of the country. Speak to them.
Well, both categories are actually vital and critical to what is to the country and to us getting through this difficult period. We need teachers for our children to continue to be educated during this COVID pandemic. And we certainly need doctors and nurses to save lives. And therefore, to me, these are not the people, the groups of people that you want to have a fight with at this point in time. And so it is it is sad that we seem incapable of reaching some kind of compromise situation, incapable of hearing their concerns and trying to address some of their concerns in a non-heavy handed way. I've mentioned before, when you look at the approach Mia Mottley has taken, where she has said, this is not who we are. We're not a people that go out and in a dictatorial way say you're going to do this or else. There must be another way of exploring how we can come to terms and how we can come to a better understanding and consensus. And I just feel that there's not enough of that has been done in Guyana. We haven't explored those options. We get to this mandatory right now. And like I said before, you never, in any situation, any part of the world where you force something down people's throats, you will not get a good response. In fact, the scenario I told you I'm hearing about today is even more dangerous, where people are pretending, if it is true, people are pretending that they got a jab and are still walking around, willy-nilly. That people are pretending they have a vaccine card that is genuine. I mean, that has got to be the worst and most dangerous way that we would go. That we would actually make persons feel that it's okay to go into the room and tell everybody, oh, I got my vaccination card, and put them all at risk.
Yeah.
So it's a very dangerous, it's a very sad time.
It's a very, very sad time.
It's a very sad and dangerous time. Because when you have people going in the back door, we heard stories of people thieving books. I heard, as I shared today, people going to locations where they pretend to give you a jab and give you a piece of cotton wool, and you pretending like, oh, I mean, where are we going? Where are we going?
Yes. Dr. Cummings, are you still there? To the nurse, the medic, the person working at these hospitals who are hesitant, what would you advise them?
Well, first of all, I think it's very dishonest if you be honest with yourself to say, well, I didn't take it or I did take it. You can't be, as Patty just mentioned, you can't be deceiving because you end up maybe killing your own family. So you have to be very careful. So the healthcare workers is a very, the nurses, Florence Nightingale, they took the oath. Even doctors took the oath. And so people see us, like in some places, like in the remote hinterlands, and so all they see is the health worker at a health post, so there's high regard for the healthcare worker. And so people look up to you. So, and they expect you to set the example, the right example. So I'm appealing to those who have not been vaccinated and who can be vaccinated to get vaccinated. All right. And I said before, that's not all. Just ensure that you eat healthy. Can't be KFC chicken alone. You have to use your lettuce and your tomatoes and your vegetables and so forth, and drink a lot of water. 6 to 8 glasses a day. I have the acronym: you start your nutrition, your exercise, your water. Go outside in the outdoors, sunshine. Avoid crowded spaces. Take the nice fresh air that we have in Guyana. Try to have enough rest. And then, of course, psychosocial support, either whether you meditate or whatever it is, So I would advise the healthcare workers, especially to get vaccinated, especially those who can, and the populace by extension. If you know you can be vaccinated, Don't wait for when you start having the symptoms. It might be too late. All right. You don't want when you have the active case. You want to prevent the active case from coming on. So try to vaccinate, get the vaccine now, of course, and you boost your immune system and so forth. As I said before, this nursing profession, the health profession, a lot of people look up to you. So they have to set the example. So I would advise them to take the vaccine. There will be a subset, as I said before, who may not be able to take it, and that's understandable.
Yeah, yeah, yeah. Should there be face-to-face classes in our schools, Dr. Cummins, given where we are with the pandemic?
That's a good question. Of course, we know that for 2 years now, the studies would have shown that we have dropouts already, teenage pregnancy, and the list goes on. And of course, you want to get them back at school. Why I'm laughing, because I remember, I think it was a father was saying that since the children are at home, every time the fridge is going out up and down, and they're eating more than everything else, and he has to go to the supermarket more often. So face-to-face, the socialization and everything, the benefits for it, it's outweigh the risk of staying at home. So if there is persons are vaccinated, and especially the public health measures, the social distancing, make sure you have sinks with running water, make sure these simple measures. But what you're finding that even this before you go on to vaccination, even the simple measures are another. Schools, you have in mind schools going to open in September. Well, August and July, get busy, get the place, make sure the grass is, you weed the grass, make sure you have sinks, running sinks, make sure the place is clean, and that sort of things. And then you dialogue, have a meeting with the Parent Teachers Association, have a meeting with your staff meeting, and so, but I don't think it was just a quick, rapid, these decisions are making without people being part of it. You must have stakeholders' involvement. Have the work done if you have stakeholders involved, because they're going to help you. And so that was missing. You must have stakeholders. You can't do it unilaterally. That's a disaster. You must involve persons inside. It's the parent teachers, the teachers, and the parents. The Parent Teachers Association. You must involve them and ensure you put systems in place. Make sure there's masks. They must have boxes of masks, PPEs. You know, etc., etc. So as long you put that in place, and then the next step will be, okay, we'll be talking about Pfizer. Just like Sunday before, you start rolling out these Pfizer vaccines, students between 12 to 18 to come. I don't think they just take it because they want to come back to school. They're tired staying home, boredom, and so forth. But you need to, communication is so important. Knowledge is power. Educate, educate, educate. We want an educated nation. We don't want a dictatorship where you said jump and I see how high. You must be able to reason, and that's what I mean. Some persons, they're not able to process it. I'm convinced now I can go and take the vaccine. I'm convinced now that and so they've already worked it out. As I said before, we don't have anti-vaxxers. We don't have persons who have conspiratory theories. We have just vaccine hesitancy, which means you can work with them and let them come over subsequently.
Kathy, we're coming down to program time. I'll give you an opportunity for some closing thoughts.
Well, based on your last question, David, the 100% answer, as Karen has said, is that we have to be able to guarantee that you have adequate water, adequate soap, hygienic conditions that exist in all the schools. That is the minimum standard. Kids have to be, if they're going back to school, they have to be able to wash their hands many, many times in the day with all of those basic facilities in place. If you cannot do that at a minimum, then you cannot. It is irresponsible to put them at risk. And that leads us then to the other question of, I know currently we are going back to school on a rotation basis, and going back to school is the ideal scenario for any child in terms of learning today. But given the fact that you're not able to do that in a comprehensive way, and you're doing some phased approaches, then you have to make sure that you step up the possibility and guarantee that more children have access to learning online. And I keep saying this all the time. That means that more children must have a device. More children must have internet at home. And with as an oil producing nation now, with over 400 and something million dollars in the National Resource Fund, there's absolutely no reason why we cannot give children that don't have the requisite tools so that they can learn online. I think it is St. Lucia the other day. We saw their Minister of Education, I think it was. It's actually education and some other ministry together. And they were actually posting a number that folks that didn't have internet and didn't have a device could call so that their Ministry of Education could provide one. Now, tell me, if St. Lucia can do that for their children, you're trying to tell me we producing oil coming on 2 years and we can't do that for Guyanese children? So there are possibilities, there are options. Technology can be used. You just have to have a commitment. And it is clear, unfortunate, that this government does not have a commitment to providing those kinds of services to all its children. People must be happy with a $19,000 voucher and grant, of which $4,500 is a uniform grant. So what internet package are you buying with that? What device are you buying for your children with that? Why are you not using the same e-government network to provide free internet access at times that can be demarcated to certain communities, absolutely free of cost? The technology allows children today to sign on to the e-government network at a particular time and only access educational chats, educational platforms, educational websites. It's there. It's a digital world. But we still don't want to explore those options.
Yes. Dr. Cummins, your closing thoughts?
Well, David, thank you for having me on the program. The present regime should involve all stakeholders to help dent the current situation that prevails. The APNU AFC coalition stands ready to work on behalf of the over 218,000 persons who voted for us and who we represent. I maintain that the health of the nation is the wealth of the nation. The health of the nation is critical to its development. Hence, there's a need for a structured approach to containing the virus. In addition, I want to send a stern, I won't say warning, request, I should say, to Minister of Health, the Honorable Frank Anthony, to obtain some monoclonal antibodies treatment for persons with mild or moderate symptoms who are at high risk for progressing to severe disease and hospitalization. We're having too many deaths. And the monoclonal antibodies can save several lives. We don't want to wait. Right now, it's 680 something. We don't want it to be 1,000, then you go doing something. Now is the acceptable time. Now is the day of salvation. Now is the time for you to do something. So I'm appealing to you, get some, we are oil-rich country, get some monoclonal antibodies. So it can use the persons who are not able to mount their own immune defense on their own. Persons who would have been vaccinated but still become ill due to COVID. Those set of persons, you can use the monoclonal antibodies. And it could be an outpatient setting at any region. Within 10 days, you walk out when you have your treatment and save lives. Why not? These deaths are, don't get me working, untimely, but preventable. These deaths are preventable. You have Regeneron antibody cocktail, which is used to help people in these categories that I've just mentioned. And so we can, from tomorrow, we can see a decrease in these deaths. We have to show that we are caring people, you know. You know, even it affects your family, then you go in helter skelter. Let's try Guyanese, we love our country, put people first. Get some monoclonal antibodies and save the lives of these people. especially those who are, with comorbidities and so forth. So basically, I just want us to work together so that we can achieve and end this virus. Thank you very much, David.
And thank you, Dr. Cummings, for coming on. Your first appearance on Politics 101 at this really critical time. And I am sure that you've provided information, because one of the things that we've been crying out for is information. And I'm satisfied that you've given us some information here. Kathy, thanks for coming on. Communication is extremely important because you have information, but if you can't communicate it to the target audience, we still in trouble. I still maintain that as public officials, as parliamentarians, that you all have a critical role to play in communicating at this time. Thank you all so much. And I want to thank the audience for staying with us as we try to work our way through this difficult period. We don't know what it would be like a month from now, but we know what it is today. And we have to deal with the complexities that are before us today. We want to ensure that those who are skeptical are not being bullied. We want to make sure that those who are hesitant be given the information for them to overcome their hesitancy. We want to ensure that those who are further away from how the information is being populated, that we have to go where they are and we have to talk to them. The message, of course, is twofold. No bullying, no to bullying, yes to life. No to bullying, yes to life. We have oil well coming, and we have to live to enjoy it. Our children have to live to enjoy it. So here's hoping that we have contributed in some small way tonight to some form of enlightenment, some form of information sharing. Somebody, Deborah says, information is powerful tonight. There has to be something in the information that we share tonight that you could find useful. Until Thursday, when we will be talking about that case, the Police Service Commission that took the matter to court, testing the constitutionality of the president's refusal, he and the commissioner's refusal to appoint those people who were promoted by the Police Service Commission. That case is coming up on Thursday. And on Thursday evening, we're going to have Selwyn Peters, the lawyer representing the Police Service Commission, on. So until Thursday, be good, be safe, keep up the struggle, and please, if you can, use your influence as an adult, use your influence as a student, a nurse, a teacher, a community leader to ensure that we put it all together. Good night.
Please help keep Politics 101 on social media and broadcast television. If you are in North America, please donate via Cash App or PayPal.
If you are in Guyana and the Caribbean and don't have access to Cash App and PayPal, email your pledge to dhines6106@aol.com and we will direct you how to get your donation to us. Thank you in advance for your donation.